Welcome to another episode of OPD Diaries case discussion series. And today in this episode we have with us Dr. Likhi Prasannan. She is PGT from Department of Organon of Medicine, and today she will be discussing one of her interesting case. Welcome, Dr. Likhi.
Thank you so much, Dr. Heena, for having me here, first of all. So, I would discuss a case on secondary infertility with PCOS. So, this lady is a 36-year-old lady who came to me in June 2023. So, 2023, yeah, June 2023, yes. So, last year. So, she has her first child in 2019, that is post C-section. It is after 6 months she got once bleeding, that is a normal menses. So after that, last 4 years she has been taking OCP tablet to get the withdrawal bleeding only. And in the last, that is when she was coming in June 2023, in April she has totally stopped all the OCPs. And when she came to me, she told that no, her weight was nearly 72 kg and she was so depressed, and no, she had a lot of emotional turmoil that we could make out from her face. So during case taking, the other things that I can tell about her is till that time of 2019, her menses and all were normal and she was leading a very good life till that. And after 6 months, I think 6 months after delivery, she has gone through a whole lot of family issues and all. So during case taking, first we would have we have a case performer, right? So in past history, I could find that she had cholecystectomy done for 1 year back, and also she has been badly affected with COVID in 2020, and she was even hospitalized and critically ill at that point of time. And other significant family history, father had diabetes. Father has diabetes and nothing specific. And regarding generals and all, I think that desire for salt was there, and sweet was there, but salt was marked, and even her thirst was and all increased. And she was a hot patient. She is a hot patient. And regarding menses, I've already told. And the interesting part, when looking onto her face, first thing we can understand that it has its root somewhere in emotional, and we are people who are very diligent there to find the emotional aspect. So I asked her, my way of taking is when I get a patient who would convey it well, I would start from life space. So I asked her, can you tell me about from your childhood how you are? So she told that I'm a very responsible, very diligent girl. I am elder daughter of my parents. We are 2 daughters. So I'm a very responsible person, and my parents always relied on me, and I had a very good academic background. Now she's working as a physics teacher in one of the government schools in Bengal. So during a case taking, I came to know that she had a very close friend. She had a very small circle and a very close friend, and this close friend got married at a age, and this lady, that is my patient, got job, a government job as a teacher. So then their relationship had some conflicts came up there, and this lady, this friend, once she was maybe out of jealousy or so, she and her husband invited this lady to a park. So they went to a park, and this husband was sitting in middle and these both ladies on side, and they just very casually they spoke, and they took a photo. But what happened is, just a day after, that lady started circulating it, just this husband and this patient. So that lady has got a very bad shock at that point of time, and she told that this was after that happened, I became a totally reserved person. I lost trust in all the relationship, because this is the only close friend she had. So after that, she hasn't married. She got married. When she came to me, she's 36 years. So just 4 years before she got married, and it was nearly 32, 33 years she got married. So the marriage was also delayed because she was not willing to get married. But speaking to her husband and conveying all that, she got married. Her husband was nearly, that the initial honeymoon phase or what. He was very cooperative with her. So she didn't have any difficulty in conceiving for the first time. But soon after marriage, that 6 months after, the relationship will also have a lot of ups and downs, because they had a father-in-law being sick and he passed away. So there was a lot of emotional constraints that happening up. And so the husband was every time like, why you want every time, that emotional sponge, like I have to be very receptive for you. So now the way she was telling that, doctor, I have been for everybody. I am a person who is, to be there for everybody to listen, but there is nobody to me. And she is telling that I don't want to express it to anybody. It is like, no, not to hurt and not to be hurt in that pattern. And so I know that everybody who's listening also will come up to that remedy. So at that time I gave her Natrimur 1M, that is one dose I have given in SAC lab. That is in June 24 or 26, I believe so. So I think within 10 days she messaged me, doctor, after 7 days I got my menses. And then I told that, no, let us see how the menses goes, because it is after 3 or 4 years she's getting the regular menses. It was only the withdrawal bleeding. Then after that, within 1 month she came and she told, my weight was 72 kg, doctor, now I have lost 6 kg. So that I felt a little awkward, how the patient will lose 6 kg, but I didn't tell anything because we have given only just Natrimur 1M 1 dose. So I didn't do anything. So next 3 months she just came for the follow-up, but nothing was done because the menses was coming regular. And in November or so she conceived. Okay, she conceived normally, like no other medicine was given, just this 1 dose was given. And she was also mentally doing well, and now I think her EDD was supposed to be just 1 or 2, this month it is. So I couldn't get connected to her, and after 3 months, during the 3 month scan also she has sent to me with the normal heartbeat and fetal pole, everything was normal. And so I have given medicine without repertorizing and all at that point of time, because the thing I remember was about Natrimur. It's everywhere Natrimur is a kind of a sensitive person who always look nourishment from relationship. The Natrimur and Sepia also have a very close, they are very close to each other in matter of relationship, where they always want somebody to listen to, somebody to hold on to. But when it comes to Sepia, if that is not satisfied, they will find their comfort in like work aspect. So they are people who loves that exercise and that physical excitement. But when it comes to Natrimur want to be people to be like an emotional sponge every time, understanding them, being there for them. That intimacy is very, very important for Natrimur. So she got it initially from her husband, and then she didn't get it. So that made into something very significant for her. So I was also seeing, because I have a habit of seeing into psychosomatic aspect. So I got I used to read books like Heal Your Life by Louise Hay, and from Know Yourself by John Romero. So in that it is telling that in case of ovary is something that is leading to creation. So she was having bilateral polycystic ovary. So ovary is creation also, and also nourishment. Right, a mother is nourishing their baby. So nourishment, so nourishing, that is ovary is about the people whom we hold close to our life, very close to our life. So if we are losing people who are very close to our life, then ovary will get affected. So when it comes to female especially, it goes to genital tract more. So it can be a mother losing a child, or somebody losing her father, mother, passing away. So we can very clearly relate how Natrimur is a very important medicine for grief also, how it is coming in that aspect. And when it came to her, it was her husband who was very close to her in one point of time. And then the parting is just like losing the person, right? A person is not willing to be intimate to her. So I could connect that, that intimacy has been lost. So that was a very good insight, but when we relate to it, we will also be able to relate into these aspects.
That was really interesting case, and that is what nowadays we are seeing many cases of PCOS, fibroid, and all this. So if we see what is the psychosomatic you are doing Organon, if you could explain more about why it is happening, why these things like the cases are increasing these days.
Psychosomatic is something I would love to explore at every time and any time. That is why I did my masters in psychology also, because I have been also going through many psychosomatic disease at one point of time, I think in 2017 or so, where I had a very bad pelvic pain, and that was the time I did my MSc in psychology also. Because I think that if you can master your mind, you can master anything in life. Because mastery of mind is so important. We can just relate to days where we are so happy and we do everything effortlessly. When we are a little mood off, means nothing works that day. So it is like mind that masters everything. So when body, it is psychosomatic, you can't be always very happy, you have to be in low phase. But I think psychosomatic diseases, in nutshell, it shows up when you are not dealing with your emotions rightly. if I am sad, if I am having fear, I should be able to face that fear. If I am sad, I should not be showing up to world that I am happy. No need. That is what makes the difference. Suppose if the body is not, if you are not giving an outlet through your emotion, then body will find its own means to manifest it. Okay, because she was something, now this case itself, she was going through that grief, but she is telling that I will not talk to my husband also more, might be because you know that Natramur is a very egoistic personality also, who doesn't want to show up like, I am so vulnerable. So she doesn't want to convey him that I care for you a lot, I love you a lot. So that emotion that she's holding on is showing up in some other way. So I think psychosomatic diseases can be kept into minimum when you deal with your emotions rightly. That is, there are ups and downs in every time. Like in a day itself, we go through lots of ups and downs. So be with that low phases. Now people have to be always in high mode. Yeah. Exactly. So like if you don't feel sick, if you don't feel well, suddenly ordering something and making us feel good, right? If you don't, if you break up one person, we'll go to another person, right? You can't feel the grief anywhere. No, we shouldn't be in low, always an excited or hyper excited, but that doesn't work with life. Like when it comes to reality, if you can't heal from one, you will attract such kind of people again to our life, right? Because it's a trauma response. Like I want, if I'm having a lacuna to be filled, again, I will attract only such people who will come and put again me to suffering and things. So this is, I think, the psychosomatic aspect, like, the basic nutshell, whatever the emotions are, even be fear, even be sad, grief, anger. Anger is, I would say, anger is not always anger. Anger is sometimes also the emotional expression. Like if I'm having a lot of grief and I don't know how to show up that grief, so that comes out as anger. It is not always the hate. It is like, I love a person so much and I'm not able to tell him that I love you. So it shows up as anger. Yeah, that frustration will show up as anger. So people see anger as a very bad emotion, but I would tell that anger always tells us that something is not right within us that you have to deal. Psychosomatic aspect has a lot of scope, and when it comes to a system, I think it's a gem where nobody can do anything. Others, they can simply neglect she can be put into OCPs for lifelong. She will not conceive, but with the Natramur, it has set many things right there. Psychosomatic aspect is it's an area to be explored, like I think, it has no ending when it comes to modern society.
That was really interesting. And true, because if we are able to handle our emotions well, our physical, body will be doing well as well.
Yeah.
That was really a great learning, Dr. Likhi. And having that psychosomatic knowledge of that thing, how you will relate to body parts, and then how you will prescribe, that will help us to have get more cure. So yeah,
it will help us to have more cure as well as to get that rapport with patient. Because one thing is, when we have an emotional talk, they also feel much better. So there are a lot of general management happening here, not only the dietary management, but the main homeopaths can do more than any other system of medicine there, where when we are emotionally connecting, we can ask them, this is the way you're dealing with emotion is making things wrong. No other system would do that. Okay, for them, if they are doing, only psychiatrist or psychologist will do that. But for us as a homeopath itself, we can do that. And that is an extra benefit they get from the patients who are coming to us, get from us. That maintaining costs is getting tackled there.
Yeah, exactly. Because patients are not that much aware.
Yeah.
And I think even not all of us, doctors or homeopaths, are not even aware about all these things. So we need to not just giving a mechanical prescription, dealing with all the things, and holistic prescribing is something which will help to make better prescription and help
and also take care of us also much well, because our mental state, there are things that I haven't dealt with myself. When I hear from other person, I'll get so triggered back. Okay, exactly, there are things that if somebody talks about something, we suddenly get angry and we ask, what is that you're talking in that way, or why can't you speak it back? So I think that our emotional vulnerability, seeing to that neutral, that may take time and experience. We can learn from our stalwarts, like how they have dealt with, but that also, it is so important for us, like we also be in that neutral mode. More and more we face ourselves, more and more we can face patients, and we can help them out. Because we can connect to them, like what they are kind.
That was really really great learning, Dr. Likhi. Thank you so much. And we really hope this message from Dr. Likhi will help us all, and we will be able to be aware and get connected with our patient to help them. So thank you so much again.
Thank you so much again to you for having me here. It's very nice, when we can share whatever it is, knowledge shared is knowledge multiplied, and it comes back to us in million folds. So it is not that 100 of us look 1,000 patients and we are not able to look each and every patient, right? So 100 people share 1,000 experiences means that will even go million and million. That when people don't commit the same mistake, we have more experiences. Nobody has has become poor by giving anything. Everybody grows richer and richer. New things come to us, new way of perceiving life. We can also help ourselves better, not only patients. Don't always focus on patients alone. Worth is only when you see worth in yourself, then only you can give. Whatever you give, so you get back. Thank you so much for having me here, and have a great time, everyone.
Thank you. So thank you so much, everyone. That was all for today. See you all in next episode. Till then, take care. Bye-bye.